As we know, the elderly are often immunocompromised and have many medical issues. In this population, there are certain vaccines that we highly recommend. Hello, Dr. Rekha Hanvesakul, internist and travel medicine specialist at BNH Hospital. Today, I would like to talk about vaccines in the elderly population. As we know, the elderly are often immunocompromised and have many medical issues such as blood pressure, diabetes, and other underlying medical conditions. In this population, there are certain vaccines that we highly recommend. First of all, this past 2 years, we all know about COVID-19, which has been a continuing problem. So the most important vaccination I would remind our elderly population to receive is the COVID-19 vaccine. If you've already completed the primary series, I would like for you to go ahead and get your boosters, okay, according to the recommended schedule. Kindly get this vaccine because, as we know, COVID-19 has caused so many issues in the elderly population, and many people all over the world have died from this disease. The next vaccine I would like to talk about is the influenza vaccine. Now, a lot of people would argue, why influenza vaccine? Because for the past 2 or 3 years, influenza has become less of a problem. Well, this is likely because a lot of people are wearing masks, so influenza is currently less of a problem. But as we go back to our normal lives and we discard our masks, influenza is most likely to become a problem once again. I would like to recommend that the elderly go back to receiving influenza vaccines annually. In Thailand, influenza is often a problem in the rainy season, so it is recommended to get the influenza vaccine prior to the rainy season. And in Europe and America, it's recommended to get the influenza vaccine prior to the winter season. As we know, influenza prior to COVID-19 was causing a lot of deaths in the population. So getting this vaccine is highly recommended in the elderly population. The next vaccine I would like to talk about is the pneumococcal vaccine. The pneumonia is a problem in the elderly as they have weakened immune systems. When the elderly catch either COVID-19 or they catch influenza, they can get secondary bacterial infection from pneumococcal bacteria. So it is highly recommended to get the pneumococcal vaccine. There are 2 types of pneumococcal vaccine, the Prevnar 13 or Pneumo 23. I would like for you to speak with your healthcare provider as to which vaccines you need, whether you need only one or you need both. Now, the next vaccine I would really like to talk about is the Shingles vaccine. A lot of people have had varicella infection in childhood. This virus normally after infection remains in the body, in the dermatome. And as you get older and the immune system is weakened, the virus may come back and cause issues. So what the symptoms you may experience may include burning, sensation, tingling, or you may have vesicular lesions. Now, this problem may occur again and again if your immune system is weakened. Therefore, it is highly recommended that people above the age of 50 get the zoster vaccine. And the other vaccine I'd love to talk about is the combined tetanus, diphtheria, pertussis vaccine. This vaccine, a lot of people would have received in childhood, but as they get older, this vaccine is often forgotten. So as we know, tetanus is a problem if you get stuck by a needle, a rusted needle, or if you're exposed to dirty soil while gardening, okay? So it is recommended that you get the tetanus vaccine. Now, diphtheria and pertussis, a lot of people have received the combined vaccine in childhood, but as they get older, the immunity often wanes. So it is recommended that every 10 years, you do get the combined diphtheria tetanus vaccine, and at least once in adulthood, get the combined diphtheria, tetanus, pertussis vaccination. In addition to the vaccines I have just talked about, there are other vaccines that are also recommended, such as the hepatitis vaccines, rabies vaccines, meningitis vaccines. But whether you need these vaccines or not, I would like you to discuss with your healthcare provider. As COVID-19 becomes less of a problem and we all go back to living our normal lives, it is highly recommended that our elderly population receive the required vaccines so they can continue to live a healthy life. Thank you.